Hey, the Green River District Health Department is raising awareness about breast cancer this month. Merritt Bates Thomas is here with more information on this important topic. Good to see you.
Good morning.
It's, it comes around this time of year, and of course, we always need to be aware of what we need to do to take care of ourselves.
Right.
So what are you asking people to kind of dial into here this month?
October's the monthly awareness, but every month out of the year is important for women in terms of where they fall with getting their annual mammogram, if that's in their line of health and wellness. So women age 40 and above need to talk with their physician about getting that annual mammogram. That conversation can change depending on family history and what their risk might be for developing breast cancer. So just knowing your risk, do you have that family history? Are you doing your monthly self-exam once or twice a month, as people are guided to do, and just being familiar with any changes you might detect as you do that monthly self-exam.
Do you offer educational material for people that maybe have not started that practice to know exactly what they're doing, what they're looking for?
We do,
okay.
We do, along with our partners from the Kentucky Cancer Program, working to create awareness for everyone. And what we find too is that many times it's an access issue. There are mobile mammogram units that go throughout our district, so calling attention to those where there are access issues for health care. And that way people don't have to travel as far. And making sure that there is awareness around when those dates are, where they sign up, how they get access to that valuable screening tool.
Well, I think it's always in the back of your mind when you're a woman, but who's most at risk, or what are the risk factors that we need to be aware of?
Well, the key things we can do, taking care of ourselves, like we talk about almost every month, it seems like. Yes. So healthy diet, as healthy as it can be, working to make changes if you need to, being physically active, surprisingly, contributes to reducing that risk. That doesn't mean that if you are active, you don't get breast cancer. You could, but the key is that early detection and being aware. Watching your alcohol consumption as well, and making sure ideally it's in a range of about no more than 1 drink a day for women, no more than 2 for men. One of the things I failed to say too is men can also get breast cancer.
They sure can.
They can, and I think the alarming thing around that is we've thought it was a women's issue for so long, creating that awareness and making men aware that it can impact them as well.
What are some symptoms we might watch for?
Changes, if you're paying attention, just basically knowing your breasts and what they look like. And if you notice changes, if there's discharge, anything at all, and having that conversation with your provider if you're going in for an annual check. What do I need to look for? And they can guide you through the process as well about how you do your own self-exam.
Do we have to have a doctor's referral to make our appointment at the mammogram clinic? Okay.
Yes.
So,
yes.
Your primary care.
Now, for the screening unit, the mobile unit, I'm not certain, but connect with that mobile unit through the Kentucky Cancer Program, or I believe Deaconess Medical System also is the operator of the primary unit that goes throughout our area.
So for all this information and more, Merritt, how can
the Kentucky Cancer Program will be the source for the information we're using. They have great information, no need to replicate it. And then we post things on our Facebook page, and there is information, basic information on our website.
Merritt Bates Thomas, thank you.
Thank you.
More lifestyles and Ron's weather right after this.